Up to 50% of women entering perimenopause and menopause may have pelvic organ prolapse. They may notice that they're having difficulty emptying their bowel and bladders. They may feel a lot of pressure or heaviness in the vagina. They may notice that something's actually inside of the vagina, or even worse, coming out. They go to the doctor, they're diagnosed with pelvic organ prolapse, they're told we can fit you for a pessary, you're a surgical candidate, or you can choose to live with it. I'm here today to talk about the fourth option, which is pelvic floor physical therapy. Generally speaking, pelvic organ prolapse is classified in terms of stages. So stage 1 is when one of these organs or a few of these organs are just starting to herniate into the vagina. Stage 2 is when the organ descent is a little bit more advanced than stage 1. By stage 3, we're actually able to visually see one of the organs at the opening of the vagina, and stage 4 is when the organs are actually coming out of the vagina itself. Women are going to notice pressure, some urinary issues, there may be some difficulty evacuating urine and stool, may feel like there's some heaviness, it may be more bothersome in standing, it's more bothersome towards the end of the day, and can also be a problem when women are trying to exercise. So what women may notice, because our pelvic floor muscles are partially responsible for keeping the organs up where they belong, as our muscles fatigue, we're going to have more bother with prolapse. And what makes our muscles fatigue? Obviously, we're more tired at the end of the day. If we're doing high impact activity where our pelvic floor muscles have to contract to support us, that may result in some symptoms after or during exercise. Core work or strengthening exercises can also lead to some fatigue in the pelvic floor muscles, which make them less available to help support our organs, which may make symptoms of prolapse a little more bothersome. There are a number of risk factors that are associated with pelvic organ prolapse. Chronic constipation, chronic coughing, sneezing, obesity, smoking are just some of the leading causes. But the number one risk factor that will lead someone into developing pelvic organ prolapse is actually vaginal childbirth. So many women do not realize that after you have had a vaginal delivery, you should have pelvic floor physical therapy to help rehabilitate the muscles. If someone doesn't undergo pelvic floor physical therapy after childbirth, they're entering their next phase of life with weak pelvic floor muscles. Pelvic floor muscles and our ligaments help support our organs. If the muscles are weak, that puts a ton of strain on the connective tissue ligaments, which lead to a descent of these organs over time, which eventually become prolapse. So when we're talking about pelvic organ prolapse, there's a number of things you cannot control, such as your genetics and the laxity or strength of your connective tissue ligaments that help support the organs. But what you can control are the pelvic floor muscles, their ability to work with the core, and their strength and endurance. So as we get our pelvic floor muscles effectively working with our core muscles, that is able to provide support to our organs to help override some of those things that we can't control, such as the strain that can happen during delivery, constipation, or chronic coughing, or obesity. Proper pelvic floor muscle activation during specific activities is really key to help the organs stay where they belong. Many times, women do not have control of their pelvic floor muscles. They don't know how to properly use their pelvic floor muscles when they exercise, and they actually can be doing things that are harming the ligaments and leading into prolapse, and they don't even know they're doing it. This is why it is so important to work with a professional before engaging in any type of activities that you think actually may be fitness-based or therapeutic, when in fact you could be doing things that are hurting your pelvic floor. Our pelvic floor muscles, as well as the connective tissue supportive ligaments, have estrogen receptors in them. As our hormones naturally start to decline as we enter our 40s and 50s, this can result in a weakening of both the connective tissue and the pelvic floor muscles. In addition to what you can control, both in your fitness routine and with pelvic floor physical therapy, many women may want to discuss hormone therapy with their doctors to see if they can optimize this aspect of their care. If you suspect you have pelvic organ prolapse, the first step in your recovery is coming to see a pelvic floor physical therapist. If you are unable to come see one of us in our 9 locations listed below, we have also linked resources on how to connect with us virtually.